All right, I haven't gone live at YouTube in a little while. Uh, Alex says hi. Hello, Alex. I just started. It's been a little while since I did a live over here because I've been so busy. But I decided to try to squeeze one in here before, before 8 o'clock Eastern time. Hello from Michigan, and Erica is here. So we already have 3 people, which is maybe more than I thought. If I can, I'm going to schedule these things. The problem is I realize just how insane my personal work schedule and life schedule has been for the last maybe like 4 years. And so I am making active changes to my schedule to give myself a little bit better life and try to do more of this kind of stuff. I just have to find a way for it to actually pay me. Alex is a pathologist. Melissa is here. Jane Bullington from Kentucky. Good to see you. So this live doesn't really have a topic per se. I'm just here gonna answer questions for like 30 minutes. I have, in case I need to draw, I have my whiteboard and I have my marker, and hopefully there's plenty of ink in here. Seems like it's working. Chloe, it wouldn't be a YouTube live without Chloe. She's definitely a regular like Erica. I appreciate the people who come in and talk and ask questions. Jenna as well. I'm starting to recognize names now, you know, like I see the same names popping up. It's kind of cool. It's a tight-knit community, I suppose. So I don't really have a topic tonight. Basically just going to answer questions for a little bit because I haven't done any YouTube work here for a while. So if you have any questions, you can ask me. I'll probably be on here maybe 30 or 35 minutes, hopefully. When I do YouTube lives, dead air is, I remember, first of all, I used to do a TV and radio production class when I was in high school. And they talked to us about how dead air is the absolute kiss of death for a radio station or a TV. So you don't want to have a time where you're listening to a song or someone's talking and then it just goes silent. Or you want to time your announcements perfectly so that when it ends, it goes right into the next thing. On TikTok, dead air is not that big of a deal because I'm reading so many comments. But the fact that so many people come and watch these lives after they're actually live, I kind of have to keep it going here. I can't just sit and stare at the screen. Let's see here. Jane says, all the buzz on TikTok is that everyone has parasites. Do you see a lot of parasites? So I've been meaning to make videos about this. The only reason why I haven't is because people are very attached to this idea that parasites are filling our bodies head to toe. And so naturally, when I make such a video, I'm going to draw in a lot of these parasite weirdos. And they're going to, you know, report my page and all that stuff because it goes against their worldview. Let me tell you what I've seen, okay? I have been a medical doctor since 2004. So I am in my 19th year of medicine. In that time, I have seen many living patients, thousands, you know, and then in forensics, I have done about 3,000 autopsies. When you look at my surgical pathology career, in which I am looking at biopsies and specimens from living patients, I have probably, if you just say number of patients, probably 20,000. So let's just say medical school residency, and fellowship, and then my career, I've probably seen something like 30,000 patients, or maybe even 40,000. And in that time, deaths, we'll talk about actual infections shortly, but deaths due to parasites, in my experience, has been, I believe, zero. There may have been one maybe that I'm not remembering. So you have to see almost 20 years of medicine, something like 30 or 40,000 patients, zero deaths. Now, how many parasites have I seen unexpectedly in autopsies? So the answer to that question is, I think it's zero, actually. So I'm trying to think. I've never signed out a death as a parasitic death, and I'm trying to think if I've ever seen an unexpected parasite in a person. And there's nothing that comes to mind. So I think there's zero on that. Now, if you talk about parasites in biopsy specimens for people, now that when I was a surgical pathologist, I might see something like 4 cases a year. So if you look at my surg path career from 2004 to 2018, that's 14 years times 4, about 4 or 5 cases a year. So, we're looking at 60 to 70 total cases. And of those cases, we have about probably half are Giardia, which is just an organism in the water that, if you're in the mountains and you drink water out of the creek, you get diarrhea. And then there's other parasites that we've seen, pop up in people who have like immunosuppression, particularly those bone marrow transplant patients and HIV, end-stage HIV patients who aren't taking antiretroviral medications. So it is a phenomenon, and I suspect that it's on there on TikTok and other places because someone's trying to sell you a tonic or something to rid yourself of parasites. I mean, parasites exist, there's no question about that, but the numbers in which they exist in the United States are stunningly low. We're talking, a handful of cases per year of parasites, okay? Now, if you want to talk about internationally, countries that do not have good sanitation, countries that do have practices of eating animals that they don't cook very well, something like that, you do see a lot of parasites. And so most of the parasite cases that I personally saw as a doctor were people who came from other countries. And they ate raw meat, and they got, a pork tapeworm causing neurocysticercosis in the brain. So yeah, I mean, these things can happen, but not in any kind of civilized society with good sanitation. So I'm glad you asked the question because I've been meaning to address it. I just haven't made the video because it's going to be tiresome. You guys know how tired I am already by people who will not accept reality. Let's see here. Let's go back here. There's been a number of questions. Do you have to complete any continuing education as a pathologist? Yeah, you have to complete continuing education or else they'll revoke your certification. So, you're supposed to turn all that certification stuff in every 2 years. Son's girlfriend is 23 weeks gestation and having cervical thinning and dilation, hoping she stays in. I am worried. What do you think about Franciscan and Lafayette? Well, I do work in that area, and I don't really know the doctors there very well. So I don't really have an opinion, positive or negative, because I've never been a patient there. I live in a different area of the state, and I don't really know any of the doctors at Franciscan, and I've never been a patient at Franciscan, so I can't really give a recommendation one way or the other. So I think a lot of people who eat raw fish are worried. Yeah, I agree that raw fish can contain parasites. Um, there is a parasite called Diphyllobathium latum, and that is the fish tapeworm. You can get it from that. You also have a disease, I believe it's in raw crabs, called Paragonymous westermani. And those are the two that I've seen in parasite cases, but again, vanishingly rare. We're talking maybe 3 total cases in my career. I think that eating raw food, raw meat, is a very bad idea because you don't know, what the behavior of that animal was before it was prepared for food. So I am always pro cooking whatever kind of meat, and I know that some sushis are raw or whatever, but culturally in some areas that's how it's done. I personally wouldn't do it, but of course, I'm risk averse. Um, yes, yeah. Well, you're welcome for the thorough response. It was probably more of a response than you were looking for, but I get comments virtually every day on my posts at TikTok asking about parasites. And, when I first started on TikTok, I would answer those. I would say that's not a real thing that's occurring. And then people would get very angry. So I just realized I don't want to deal with them. And I made a post yesterday about pancreatic cancer. And I saw somebody post, well, parasites are causing this. How come doctors aren't treating people? And of course, this is simply not true. Parasites can be associated with some cancers, but pancreas cancer is not one of them. There's a parasite called Schistosoma hematobium. By the way, you're probably wondering why I know so much about parasites. That's because I was a medical, my undergraduate degree was in microbiology. And then when I went on through to pathology, part of becoming a pathologist is you have to become an expert microbiologist. And then on top of that, I actually did moonlighting, so it means I did extra work doing preparations looking for things like parasites. They were called immunosuppressed protocols. That was done at IU Hospital and Methodist Hospital in Indianapolis. So whenever somebody would come in with a potential disease that was parasitic and I was on call, I am the one who would make all the preparations, do all the stains, look at them under the microscope, and then call the doctor. So, sometimes you would get a person coming in from, the Congo, and they would have a fever. And then you would get a blood smear and you would find that they have malaria. And so then they would have to treat the malaria. And other times it was, a neurosurgeon takes a little biopsy from a brain abscess of somebody who has HIV. And then you would find that it's, toxoplasmosis. So yeah, I know a lot about parasites. So I get a little irritated when these people come into my posts and they say, well, obviously it's parasites. I mean, there's no question. We all know what causes it. It's parasites. And meanwhile, I've spent 20 years looking at tissues under the microscope and you just hardly ever see parasites. Now, that being said, I get very excited when I see parasites. I look for parasites in every single tissue that I look at. Even today, if I look under the microscope on any of my autopsy cases, I'm looking for parasites. Because if you find them, it's extremely exciting for somebody who already loves microbiology like myself. So other doctors maybe who hate microbiology, maybe they're not going to be as looking at for those things as much as I do. But I look for it on every case. And I've been consistently disappointed because it's not a thing that's routinely occurring in the United States. Any other questions? Yep. I was on TikTok earlier for a live. I had a little extra time today, and I'm a little bit, when I have like a huge amount of work, sometimes I just shut down and decide to do things that are not productive. For instance, next week I have 2 murder trials. One is a stab wounds case. The other one is a triple homicide gunshot wound case. In addition, I already have 5 autopsies that I'm supposed to do in the first 2 days of next week. So I have all these trials, I have all these autopsies, and frankly, it's so much that it just irritates me because I have to spend so much time preparing for trials and stuff. So I said, you know what? I'm just going to do some lives today. So I did TikTok and then I do YouTube. Um, YouTube, it frankly is better because the people who come here and ask questions are virtually all sane. Okay. When I'm at TikTok, there is at least 10 to 20% of my comments who are commenters who are insane. And so I much prefer being here. Plus, when I'm here, it adds to my watch hours for my channel, which pushes it toward monetization, which is a good thing because then I can do more of this and actually get paid for it. How many trials do I do a month? It varies. Some months it's 0, other months it's 4. So it's random. They don't schedule them because see, I do trials mainly on murder cases. So the amount of trials I have is based on the number of murder cases I have. And then those murder cases might be tried in 2 months after the death, which is really unusual. But they're usually tried something like a year after the death. Sometimes even 2 years. And in fact, I have a case I think it's in Fort Wayne coming up this summer that is a case that's 5 years old. So, you're never free until all of your homicide cases are either they've gone to trial or I guess they're just unsolved. There's no suspects or anything like that. So can you opt out of a trial, have someone prepare and speak on behalf of your work? Really, no. You can if, like, let's say I were to move I live in Indiana, but let's say I were to move to California or I were to move to, Spain or something. Well, clearly it's going to be difficult for me to be in the courtroom. So in that case, you can get what's called a substitute pathologist. I personally have to testify as a substitute for other pathologists who have left my state sometimes, but I can't just say, hey, I don't want to come. If I'm in the state and they subpoena me, I pretty much have to go. Do I feel child murders are increasing? So in my area, I actually have not had an increase. If you want to talk about nationally, I mean, when you have dozens upon dozens of kids shot in schools every year, naturally the rates are going to go up. But in terms of my practice, no. I usually have, how many child homicides do I have a year? Usually it's somewhere between 1 and let's say 5. On the high end, I've been up near 10. And it's been that rate for the last several years, thankfully. I wish it was 0. And then Erica says, how often do I have to do a degloving? So degloving is when the body starts to decompose, or actually it's well into the process of decomposition. And the actual epidermis of the hands will slip off. So you can actually take the epidermis off like a glove, and it's insane to see. I really should film it sometime. We don't do it very often. And so then what will happen is you can put if this is what she's asking about, you can put that glove of the skin on your own hand and you can get fingerprints from that gloving. Now, if she's asking about a degloving injury, that's a similar sort of process, but instead of decomposition, it's traumatic, meaning like the entire hand or the entire foot is degloved as a result of like motor vehicle trauma. In terms of how often do I see that? I mean, a few times a year. So why do you need to be present rather than just provide the evidence? So I think what you're asking is why can't I just do it? Either why can't I do it as a Zoom or something like that, or why can't the evidence just be presented in court without my presence? Well, let me answer your first question. It's kind of seen as a professional, or my first supposition. Let's see, it's more like a professional courtesy. If you physically are present, they want you physically present to interact with the jury and interact with the judge and the defense and stuff like that. I personally would do Zoom trials all day if I could. I wish I could, but unfortunately, during the height of COVID, there was a lot of Zoom trials, but now you have to go and physically be there and get coughed on by people. So, and then the second part there was why don't they just present the evidence? Because there's nobody that knows anatomical evidence like the pathologist does. I can explain how an injury occurred, how a disease progresses better than somebody who could just be brought in and read from a textbook. Because what I have to do is I have to explain things in a way that a very uneducated person can understand. And that sounds rude, but it's not. We literally are trained to be able to describe things as if a junior high student could understand it. Why is that? Because to be on a jury, you don't need to be educated. You just need to be a person in a particular jurisdiction. And people sometimes don't have science classes after 8th grade. They go to 9th grade and then they go into like the labor track, and they're not really they're doing their basic curricula. They're not really doing science. So you have to be able to explain things like a junior high student would understand. And you really can't do that unless you have an extreme command of the material itself. And that's why the pathologist has to show up in person. Terrible cases of neglect and abuse in Dayton, Ohio. When I was starting out, about 8 years ago, we had so many child abuse cases, and I was in Indianapolis at the time. We had so many child abuse cases. It was shocking. It was stunning how many child murders we had. But since I've moved out of that area and gone to area with a little less population, not seeing it as much now, thankfully. Metropolitan areas tend to have more of those cases. There's just more people, more indigent people these tend to occur in communities such as that. Jenna says, amoeba in the eye from the pool. Have I seen this? So I haven't, but pools, if they're not properly treated, not properly chlorinated, they can harbor a lot of infectious organisms, some of which are amoeba organisms. I haven't personally seen it. Amoeba scares me because when we talk about amoeba, we think about things like you've heard of the brain-eating amoeba. So acanthamoeba, balamuthia. There's different ones and those are the Naegleria. So those are the main three. So these things can occur in pools as well. In fact, there was a case, I'm wanting to say it was last year, where it was a water park. And water parks tend to have chlorinated water. Some kid got, I believe it was a Naegleria fowleri, which is the name of the organism, brain-eating amoeba from a freshwater water park. And so what that means is probably the water is not being treated with enough chlorine or enough chemical. Do you get a sense of whether the jury understands the info as you present? Yeah, so that is a particular skill that you have to really make eye contact with the jury. I should probably give lessons to people who are testifying, like doctors who are testifying, because there are ways to engage them. And what I do is when I testify, I don't just look at the table or look past the jury. I actually look at every single juror in their eyes, direct eye contact, and I explain every single time I have a question. I talk to the jury and I look at their faces. And a lot of times what they'll do is they'll nod, like they understand. But if I see somebody that looks a little bit confused, I say to myself, Am I using terminology that's too technical? And if I am using terminology that's too technical, then I'll maybe dial it back a little bit and I'll explain it in a different way. Or I'll maybe use some kind of different demonstration, or I will use an analogy. But being able to read jury is an extremely important skill for a witness. And it's something that I think naturally I always was good at, because when I would give presentations, I would always engage the audience, which is kind of interesting because I'm a very antisocial person and do not like to talk. If I'm in public, I do not like to be talked to. I do not like to strike up conversations with people. But when I give lectures and when I talk to juries, I do try to engage them as much as possible. So you have to be able to read people a little bit, yes. And I don't know what they teach in law schools about that. But we don't get that kind of training as doctors that go and testify. You kind of have to just do it off the cuff. And some doctors are good at it, and some doctors are not good at it. But I've always been able to speak that well. So Erica says, did I take speech in college? No, I didn't take any classes in college that required that sort of thing. Most of my classes in college were scientific classes, and then the ones that were not scientific were writing type classes, and very few of them required any kind of like oral presentation. I don't know why I don't know why I'm good at it. Because I mean, as a child, I was fairly shy. But when it comes to talking about things I know, I don't know, I'm able to do it somehow. So I did not have any formal training on how to do speech. Although I kind of wish I would have. Speech or debate, I think would have been great. Chloe says, I've been looking into different forms of research options and have been very interested in the body farm and researching stages of decomposition. Have you done any field research? So I have not done any field research like that. First of all, in residency, there's no time. In residency, the kind of research you do is usually surgical or cytopathology related, molecular pathology related. And so that was most of the kind of stuff that I did, was help out. You look at 200 bladder cancers and you stain it with a certain type of immunohistochemistry, and then you record the results and then you write a paper on it. That's kind of what you do. Now, when you go to fellowship, you do have an opportunity to do research. I personally did a fellowship at a place that was basically what you would call all service, meaning I did autopsies all the time, all the most difficult autopsies for an entire year. Not much research. Now, if I felt like I wanted to research, they probably would have said, okay, let's do it. But I was at the point of my life where I just kind of wanted to get to work. There are fellowships you can go to and do research, or if you felt like it, you could go do a master's, you could do a PhD, and you could do research prior to going to medical school in that area. But that would be my recommendation, is to look into that. I personally don't do a lot of research. I am a contractor pathologist, which means if somebody needs help doing autopsies, doing a certain kind of case, that I'm the guy. But I'm not really affiliated with medical center and doing research. I feel like that time has probably passed for me. I think it's more of a younger person's game. Any other questions? I'm approaching my 30th minute here on this live, and this was intended to be a short live. So I'm probably not going to go too much longer, but I will answer any questions you guys have. Of course, I say you guys, but I know that pretty much everyone here is female, although there are some men here. It just so happens that women seem to be really interested in this field. If you look at my TikTok followers, if you click on the pie chart, it's like probably 85% women. So, but I sometimes say you guys, just something I've said ever since I was little. Any other questions tonight? Unannounced lives, I don't expect there to be a lot of people asking questions or a lot of people even here. but I really hope to get on a schedule in the future as I dial back my work a little bit, and then I can start scheduling these things, and then everybody can come in with their questions all ready to go. Is fellowship like an internship? So it's not internship in terms of, if we're talking about medicine, that is, of course, the first year of your residency training, like right after you're a doctor. Fellowship is what would be considered specialized training. So, like, for instance, let's say you've got a cardiac surgeon. Okay, he's going to do 6 years of a general surgery residency, and then he's going to do like maybe 4 years, or I think it's 3 or 4 years of cardiac surgery fellowship to become a cardiac surgeon. And then to specialize in that, let's say he wants to be a pediatric cardiothoracic surgeon, then he'll do an additional, I think it's like 3-year fellowship in pediatric cardiac surgery. So with pathology, you go and you do your residency. So your first year, I mean, people call it intern, but in pathology, it's not the same because we're not out rotating on the wards. So basically, you have 4 years of pathology residency. It used to be 5, but they cut it to 4. And then after that, then you decide what kind of pathologist you want to be. If you want to be a cytopathologist, you go do a cytopathology fellowship. If you want to be a neuropathologist, you go do a neuropathology fellowship. And I did a forensic pathology fellowship. So it's specialized training, but it's so focused. It's not all over the place. Intern type year is you're all over the place. And then as a surgical tech, would I be qualified to assist in autopsies? Yes, you would. Okay, what else do we have here? Maybe a couple more questions if you've got some questions. I know I tend to answer the same questions sometimes over and over, but as long as you guys don't mind, I don't mind doing it. So the qualifications to be an autopsy assistant really are just to have a pathologist that can teach you how to do it. I have 2 assistants. Well, I have 2.5 assistants, really. My one assistant, he was doing autopsies before I was, so he knew how to do it before I did, but he was trained on the job. And then my other 1.5 assistants, I personally trained them, and they had no background in anything autopsy related. So I trained them over a period of weeks or months, and then, now it works well. So, all right, I guess maybe let's do one more question, and then I'll go ahead and wrap it up so that everybody can get on with their evening, and I guess I can maybe do something semi-productive this evening. Any more questions tonight? It says 33 minutes. I'll wait until it clicks to 34, and then I will get out of the live. But I do appreciate everyone hanging out and answering a few questions. You know what I would really love to do, though? I would love to be like a video game streamer. Like, that would be ideal. Somebody needs to figure out how I can do that, so I can just play video games and people can talk to me, and I can get paid to do that. So unfortunately, I don't think that's going to happen very soon. But all right, 16 seconds, and you are all welcome. You're all welcome. If you have any more questions, you can just keep me in the loop, and I'll try to do a few more lives. And you all have a good rest of the weekend as well. And I will talk to you next time. Hopefully next week. I need to do these more often. I need to make more videos on here because I need to get my watch time up. So thanks again. I appreciate everybody.